Cold plunge therapy has become increasingly popular among fitness enthusiasts and athletes. From professional teams to weekend warriors, many have claimed that immersing your body in ice cold water not only aids recovery but also enhances performance. But is there science to back this, or is this another fitness trend? Hi, my name is Dr. Sanesh Tuteja and I'm a consultant in arthroscopy and sports medicine at the Fortis Hospital Mumbai. Cold plunge therapy essentially involves immersing your body in ice cold water. What this primarily does is reduces the inflammatory response of your body. When we work out, our muscles develop a micro tear, and the body naturally tries to heal these tears by the inflammatory reaction. The most obvious effects of cold plunge therapy is in reducing delayed onset muscle soreness by about 20%. This means that you will have less muscle pain after 24 to 72 hours, which will enable you to train sooner. However, the short terms of the cold plunge therapy have to be balanced out with the long term adaptations, because once what happens in cold plunge therapy is that it blunts the good inflammatory response of the body, which may be essential for muscle growth. Temperature matters in cold plunge therapy, and the optimal temperature is between 10 to 15 degrees centigrade. However, lower temperatures have been used. The downside of this is that it pushes the body into a shock mode rather than a recovery mode. Additionally, an exposure time about 10 to 30 minutes is ideal for most individuals. Timing is also important, and many athletes would benefit by the cold plunge therapy within 30 minutes of an intense workout. However, if muscle growth is your primary focus, you may want to delay the therapy by about 1 to 2 hours to gain from the initial inflammatory response that would aid in muscle building. Having said that, cold plunge therapy is not for everybody, with uh, because sudden fluctuation in the temperature can put a lot of stress on the cardiovascular system. Therefore, people with pre-existing heart diseases and Raynaud's phenomenon may want to avoid this. For these individuals, an alternate therapy which involves use of cold as well as hot packs may be beneficial. In such instances, you can use a cold pack for a minute followed by a hot pack for 2 to 3 minutes. Repeat this 3 to 4 times and end with a cold pack. So does cold plunge therapy aid muscle recovery process? Well, the evidence seems to suggest so, at least in the short term. However, the long term implications are more nuanced. Cold plunge therapy could therefore be used strategically in between intense sessions to aid recovery rather than routinely. Thank you.